Dr. Michal Waldfogel, welcome to the Root Cause Medicine podcast.
Thank you. It's so nice to be here.
I'm so glad you're here, and thank you for hopping on with me kind of last minute. We are filming this because a week ago, the U.S. Surgeon General issued a significant advisory regarding alcohol consumption, highlighting a strong link to cancer. And you were the first person I thought to call because in my circle and on social media, this was getting really strong reactions from folks. I think there was some evidence that was brought up in this announcement about alcohol being linked to 7 different types of cancer, hundreds of thousands of preventable deaths every single year. And I think people were wondering, well, what's next? And you are an expert in answering that question when someone gets to a place where they want to reduce their alcohol consumption or even start to understand their relationship to alcohol and work to make it much healthier. So I reached out to you. You were so sweet. You moved your schedule, hopped on a call with me. So Dr. Michal, can you talk to people about kind of why this is important?
Yes, absolutely. So I want to also put in context that this is important. And there are so many things in this world that we know are good for our health, and still we don't make that change. So just kind of normalize that piece as well. And that's part of living in our modern world and just normalizing that. In terms of this specific announcement, I think that it is important to have information. For certain people, having this information can be a real motivating factor, especially for people who have a family history of cancer or personal history of cancer, or just need that extra motivation to make a change. Also, for people who can kind of take it or leave it. Maybe this is a reason to leave it. I do think that this is an important step and is important in just opening the conversation more in our culture, since it's such an embedded part of so many interactions and the way that we socialize.
I love that you started with that because you're right. There's a lot of things that are linked to an increased risk of cancer, including being sedentary and consuming certain types of diets. That's a beautiful way to kind of approach this, is to take the energy down a little bit. So what are your thoughts about alcohol increasing the risk for 7 different types of cancers?
Yeah, I mean, it makes sense. You don't need to go through a whole medical education to think about which are these cancers. They're the cancers that are directly impacted by the substance of alcohol consumption in our bodies. So it's mostly the digestive tract. So it makes sense. If you're going to put a material that can be harsh or abrasive or that kind of thing on cells, it'll affect those cells. It's in the study, it talked about oxidative stress and inflammation, which all of those things change the DNA, change the structure of the cells, making more susceptible to those changes that could lead to cancer. So if we're looking at it just baseline, it's you consume alcohol, most people, through your mouth, and then it goes to your throat, and then also your voice box, and then also your esophagus, and eventually gets to your colon and your rectum. It's going to be absorbed mostly in your stomach, but then be processed first in your liver. And then because there's so many hormonal shifts that happen with alcohol use, it can affect hormone-dependent cancers like breast cancer. So it all really kind of makes sense on a simple level that these are ones that are pretty straightforward to make the connection.
Yeah, it seemed like there was also this talk about acetaldehyde. And I think that was, we learn about this in biochemistry. But I think that's news to most people who maybe haven't taken a medical school level biochem course, and they're thinking, hang on a second. So alcohol gets transformed to this thing called acetaldehyde, which can actually damage my DNA. And I think that is also an eye opener for folks. And I'm not sure that there's been a ton of press directly about that until now.
It's so funny. The way that I teach about this in recovery programs is that I show that clip from I Love Lucy of Lucy and Ethel in the candy shop where there's a conveyor belt of little kind of chocolate candies, and they have to wrap them up really quickly. And so they're wrapping them up, and then there's more and more and more come by, and they don't. It's going by so quickly that they're not able to wrap them up, because you go from alcohol to acetaldehyde to acetate. And so the issue is that with alcohol consumption and also larger amounts of use is that it gets backed up and then the acetaldehyde builds up. So in that clip, it's so funny because then they have to like put all the chocolates in all these different parts because it gets built up. But that's sort of the process of the acetaldehyde that then causes all this havoc. And in this case, comedy, but in our own life, not as more tragedy, I guess.
Yeah. Okay. And I guess that's why, I mean, I think the first question I hear a lot of people asking when they hear this news is, well, how much is too much? And so the Surgeon General has kind of issued some thoughts on this based on the research. How do you have this conversation with people?
It's similar the conversation of there are a lot of things that can cause harm in our lives, and so choosing. Um, and it's a little bit also about where are we starting from too, and what are the functions of this use. But the research that we see is that any amount is harmful, and it's also dose dependent. So cutting back is better than increasing or staying the same, and cutting out completely is better than just cutting back in terms of these particular risks. And from there, we need to figure out how to create long-term sustainable solutions, because we're not increasing risk by this day or this week or this month. Behavior, it's increasing the risk over years of our lives. And so really figuring out how to do that in a way that's sustainable. And so how much is, it's sort of how it makes sense, how it fits, and how it can, how the changes can happen in a way that feels doable and have long-term impact.
Yeah. Okay. That's a great explanation. I love that reminder that reducing consumption in general is going to add to your health. And based on actually some of the studies that were included in the Surgeon General's report, actually add, some days at least to your life. That's that study from Canada. And so, okay. So ideal, maybe zero, but ideal is going to be personal for each person. And I love that you talked about doing this like in this sort of like this perspective of your whole life, right? Just your longevity, right? Like you don't have to make changes tomorrow, or drastic changes tomorrow. And so thinking about like your entire life and then also what matters to you, what you can sustainably do. You are an expert in this, which is why you're here. And so you have helped people both in an addiction setting and in an everyday clinic setting to help modulate their alcohol use and develop a healthier relationship to it. And so it's why I'm so excited you're here, because I wanted to then ask you more about that, because that's the next question that people ask, which is, okay, how much is too much? Okay, I should generally reduce. And then it seems to be that after that pops up the issues of, but I'm using alcohol in these ways and I don't know how to replace it. Whether it's I'm using alcohol to unwind, or I always have a beer when I'm with my buddies, or, it's my way to relax before bed at night. What are sort of like the reasons that you hear that people are, using or consuming alcohol? And how do you talk them through maybe some healthier ways to get those needs met?
It's such a good point. I think that and I'm really glad you brought up this distinction between the addiction setting and kind of clinical use, how much is too much kind of thing. It's very different. Our conversation today is more on the kind of everyday use for people who can drink in moderation. Addiction is a chronic disease. It's a change in the brain where you are not able to drink in moderation. And so that's a whole different approach that often needs extra support, which is beyond the scope, I think, of this conversation, but has has some overlap as well in terms of how to support and nourish your brain and to heal the effects that alcohol might have in your body. So in terms of the question of why are people drinking, and this is, I always think there's always a reason. We're intelligent beings. We are doing the best we can to thrive and survive every day. I see a lot, and this is particularly in addiction setting, but I see it every day, that a lot of people use alcohol to manage social anxiety. Social anxiety is a really rampant condition in our culture, and that for a lot of people, in order to be in certain social situations, the alcohol helps to relax them. Alcohol increases GABA, which is the main inhibitory neurotransmitter in the brain. So it helps to kind of have that relaxation response. And so that is a big role that alcohol will play. And once you start to have those experiences, whether or not you use alcohol all the time or just in social settings, it does start to train your brain a little bit of like, oh, I'm feeling a little bit uncomfortable here. I know it's going to help, and have that shortcut. So then it becomes kind of routine. And even for someone who then goes on to do some of their work in uncovering why they might be anxious or be in other settings, that it's still something that becomes habitual, or it's something, right, that you do with your friends. I also see it with, just generally reducing inhibition. So I had one patient who I met through addiction recovery, but was more so sort of an unfortunate DUI situation that landed him there. So I don't think there was actually the addiction component for him. But he talked about how he and his wife would have a bottle of wine on Friday night to connect. And so for him, one of the places that we talked about was if they'd be open to couples counseling to talk about sort of the intimacy and ways to connect without alcohol as well. So there's a lot of different, when you start digging into it, there's so many variety of reasons that people bring alcohol in that I think is way beyond the time we have today.
I like that because that it seems like that's where you start often when you're counseling somebody who might want to come in and see you, and maybe reducing alcohol is on their list of goals. Kind of doing that motivational interviewing to figure out, well, what purpose is it serving right now? It's okay. Actually, it's helpful for us to understand why you're using alcohol, so that then we can sort of bring in these other supports to meet that need. So for somebody who is like, well, I use alcohol to relax, I take the edge off with that. Are there ways that you advise them that they could take the edge off that aren't alcohol related, that might still be kind of like accessible, easy, maybe even fun?
Yes. So there, it's interesting because there are things to do in the short term, and then there are things that are, lifestyle, bigger changes. So I'll kind of start out and work in, because like anything, foundations of health and making sure that you're having the nutrients you need, having the rest and sleep you need, having the social connection with people that you need, having the movement in your body. All of these things are important to, to maybe be able to handle the stressors in your life. Not to say that they're going to go away, but it's the experience of stress or overwhelm is often that balance between how much is going on and then how much can I deal with it? So it's either increasing your ability to deal with it through some of these foundational things, and I'll mention a few more, or as much as we have control over, reducing the stressors outside of us too, or kind of inner stressors that come up as well. But it's kind of a balance of those things. So there are a lot of other ways to support, for example, GABA pathways. So helping your neurotransmitters and staying calm through nutrients, through support, making sure you're getting enough B vitamins, making sure that you're getting the nutrients you need, making sure that you're getting enough protein and amino acids that help to build some of these general neurotransmitters. So that's kind of a general recommendation.
And let me jump in here, because for the folks at home who are listening, so GABA, as Dr. Michal mentioned, your most common neurotransmitter, made out of B6 and then glutamate, which is made from amino acids. And you need enough B6 to do that. Drinking tricks your brain over time into thinking you need less GABA, because it kind of fakes out your GABA receptors. And so we often see people who've been drinking to relax for a long time kind of repeatedly tricking their brain into thinking they've got enough GABA. They're not really making enough. And then whenever they don't have a drink, they're like slightly anxious and they can't figure out why. And so optimizing their GABA production can actually really help to buffer that process to where like you're not actually feeling anxious and in distress if you don't have your normal drink. And that's something you can show up to a naturopathic doctor or functional medicine doctor and say, hey, I read the research. I'm committed to reducing my alcohol. I run into these issues when I start to do that. And I'm curious if you could help me. When they say, I want to put you on some B vitamins or some amino acids or some GABA, this is why, because they want to help your brain get that need met without the alcohol kind of tricking your brain into thinking that's happening. The other thing, before we move on, Dr. Michal, you mentioned B vitamins. And so I actually want to take a second to talk about thiamine. So folks who've been drinking, drinking alcohol depletes of one B vitamin in particular, B1. What do you tell folks about that? What does it do? Why is it important? And like, can we actually give folks an example of like really how real this is and why they might need to consider repleting it if they've been like kind of drinking a significant amount for a long time?
Yes. So alcohol, in general, if you're thinking about alcohol, is affecting all the cells of your digestive tract and affecting the way that you're able to absorb any nutrients, the way you're able to absorb certain B vitamins, such as B12, in terms of the way the alcohol affects stomach pH and all of these things, and digestive enzymes and all of that. But then also, specifically, it blocks the absorption of B1, of thiamine. And so in excess, this can cause a really harmful condition, Wernicke's encephalopathy. And so that's something to consider. Most, even conventional doctors, when looking at someone who has chronic alcohol use, frequent use, that they'll recommend thiamine repletion as part of the standard care for someone.
Yeah. And you guys can get that in a B complex. So it's like, it's not hard to access. And even, I think it's just like something, I mean, the USPSTF, the United States Preventive Task Force, which is like a task force of doctors that everybody's tax dollars pays to figure out what supplements we have to take and what screenings we need. And I mean, they recommend that most people take a multivitamin because of the risk for nutrient deficiency. 31% of adults are at risk of at least one nutrient deficiency in the US. And these things we're talking about are usually in a multivitamin, which is kind of good news, or at least a B complex. I know we've got other coping mechanisms to talk about, Dr. Michal, but before we kind of move on from the B vitamins, if people are thinking, oh, that's easy, like I can go to CVS and pick out a B vitamin supplement. Do you have any advice for folks about like which types to choose or what words to look for, not to look for?
Yeah, it's important. I understand how it can be overwhelming to make these choices. Generally, first of all, we want to make sure that it's safe, that there's everything in it says what it's in it. And so you can do a little bit of research on, looking at third-party testing of products to make sure that it has the quality that it says it's going to be. Also looking at what is in it, and so what are the amounts. And so if you are choosing to take a multivitamin instead of taking a B complex, you want to make sure that those B vitamins are in an adequate amount. And you also want to look that there's a variety of nutrients, and that there's nothing extra in there that could be causing harm.
And probably worth a conversation with your doctor, especially if you have a functional medicine doctor, of like what forms of B vitamins are good for you, maybe based on your epigenetics. A lot of folks like the methyl B vitamins. They try to, focus on those. And so Fullscript, for those of you who don't know, I mean, Rupa Health and Fullscript have joined up. Fullscript has a line of supplements that is sold that is essentially pharmaceutical grade. We know that they're third party tested. We know that they're quality. Our doctors are going through the warehouse, picking things off the shelf blindly. The company doesn't know we're going to do this, sending it off for testing to make sure it's free of contaminants, that it actually contains what it says it's going to contain, because the FDA is not doing this in America. So you have to put your trust in a company that is actually doing it well. And so that's why Fullscript exists. And so if you see a functional medicine doctor or a doctor who's using Fullscript, they have access to a catalog where they can give you products that are actually vetted, which is a huge relief. So I love that you talked about that, Dr. Michal. So I want to move on to other things because you have a whole list. So we talked about like, hey, just make sure you're healthy and that your brain isn't kind of starving of the nutrients that it needs to help you feel calm. Brilliant. What are the other things you advise people to consider?
Yeah. And also that made me think just generally of, we want to feel like we're in control, right? We want to feel like we're in control of our choices, our behaviors. It can feel really stressful and disempowering when we feel we're at the whim of eating this thing or drinking this thing or, putting ourselves in situations that are unhealthy for us. And so a lot of this too is strengthening the connection to I call it the grown up in the room, that part of our brain, the prefrontal cortex, that really helps us with decision making, forward thinking, and all of that. And so feeding it properly is really important. And then any of these tools, we talk a lot about mindfulness. There's great research in mindfulness activities that help with self-reflection, awareness, slowing down, that we can see, oh, in this moment, I'm thinking that I want to have this drink, but let me take a moment and see, check in with myself. Do I actually want this? Is this what I'm going to, how am I going to feel tomorrow if I drink this? That kind of thing. And those help strengthen the connections that neuroplasticity, the way to improve how our brain functions, which is so empowering, I think, to be the grown up in the room sometimes.
Yeah.
Yeah. So those activities can be really helpful. And a lot of people already do this with yoga, with meditation. There's so many amazing apps that help with this too.
Are there apps you recommend or websites or like free resources that can help?
Yeah, I have a few. I'll start with the ones that I have no affiliation with, which are I really like the Insight Meditation Timer. They have a free version and then also paid version. And I think they just have great quality. I have no affiliation. I just use it myself. And that can either be time meditation for yourself. But the thing is, there's lots of guided meditations, which can be really, really helpful. I personally love yoga nidra meditations as a way to shortcut into that rest and digest parasympathetic nervous system. So that's one type of meditation I really recommend often. And so that's a great one. There's tons of other ones that I know about, but that's just the one that I recommend in my practice most of all. And then I'll mention this one, which is Sunflower Sober, which is a great, great app with a colleague of ours that I do have some connection with. I've been working with them to create educational tools. And so I think it's great. It's really helping to build also for people who have a dopamine response with alcohol or some other substances to help to shift and restructure the brain towards healthier ways to get dopamine and getting that motivation and behavior. So those are two apps that I would just recommend with full disclosure. I think in all these cases, it's about education, about empowering yourself, about feeling like you're in control of your life. And that's what this podcast is about too. You know, some people do great going through years of therapy and all this, and that I often recommend that as a root cause for a lot of mental health concerns and addiction or just sort of certain behavioral health concerns. And also there's a lot we can do to educate ourselves and use, I'm sure people are using this podcast just to learn more, to resource themselves and to get that information to motivate change.
Yeah. I think there's another group of people who are like, I like the taste of beer, or whatever. And so there's some alcohol-free beer, alcohol-free wine. And so, I mean, I've noticed recently even that people will have an alcohol-free beer and that's kind of what they're sipping on all night. They might end up also having one regular beer, but they kind of like will go back and forth or just kind of incorporate alcohol-free beverages. So they end up drinking less alcohol total. How do you feel about that? And like, if you're a fan of this or you think it's a useful tool, are there some brands that you recommend?
Yeah. So again, I'll just take it back to this original conversation. Less is better than more in this case. And so, right. So if you're using to pull back, also we haven't mentioned dry January, which is we're in process of right now. And so for some people, it's a good thing to try out at least for a month or, and then see how you feel after that. But people will try out some of these non-alcoholic beers. Again, and we won't dwell on the addiction piece of it. For some people, it might be a trigger in addiction spaces, but for people who do not have withdrawal symptoms, who can control and have moderation around their drinking, I think it can be a great tool. Yeah. In terms of brands, I don't really have specific ones. There are some national brands and there's some local ones too. So you can kind of check out if you're into sort of that craft brewing culture and where you live, you can potentially find some local brews through that. Some people might use kombucha as their kind of nice fizzy fermented thing that they enjoy. That can be locally brewed as well. But I welcome if you have suggestions too. I don't have anything that I recommend in particular.
So it's interesting. If you guys have never looked into alcohol-free beverages, first of all, just like Google alcohol-free beverages and like a ton of brands will come up. But you often find them in the seltzer section of like a wine and spirit store or kind of wherever you would normally shop for alcohol, and they look like a seltzer bottle, a seltzer can. And there's Light Wave, there's Curious, there's Recess, and many of these, they're fizzy, so they're kind of like a beer, but they have relaxing herbs in them, or even magnesium. And so it's actually really nice because you'll notice that you feel like the edge has been taken off. You're drinking this delicious, like maybe even borderline medicinal. I mean, both Dr. Michal and I are trained in herbal medicine. And, you're reading through these labels and you're like, oh, look at this, ashwagandha. There's like some chamomile. So you can find them. They're probably already at a store near you. You could definitely do your research. And a lot of them are really delicious. There's also a huge trend right now on social media. So Instagram, TikTok, I'm sure on Facebook, where people are making mocktails. And so they might buy like a regular seltzer and then they have what's called like a shrub or some kind of elixir or syrup that might contain some herbs and some berries, like something that's really delicious and concentrated. They're mixing it with juice and they're still having this ritual of preparing a drink and having a really beautiful drink to sit down and maybe enjoy with company or just, by themselves at night, but it doesn't come with the alcohol. And so whether you want to like buy it or you're just consuming it, there's a ton. It just really just like a Google search away. I mean, I think some of the other ones, there's like organic alcohol-free beverages. Hi-O is another brand. There's something called Hop Water, which is like alcohol-free beer. So by the time this comes out in like a week, there's going to be 8 more brands, a lot more brands, probably actually, maybe more than 8 because of this new news. So you have a lot of options, and that is a really nice way to still have your ritual, still have the taste, still have the sensation, but reduce your alcohol intake.
I want to add one thing. Those are really good suggestions, but I just thought about the idea of having bitters, and sort of that specifically one of the actions of bitters or herbs that have that bitter quality to it is tonifying the vagus nerve or the parasympathetic rest and digest nervous system. And so it's something that typically is already at a bar to be able to have just bitters added to seltzer water, soda water. That could be a cool thing to ask for or try to make for yourself to still have that kind of calming effect as well. I was going to just share that my mom's been on this kick of creating a dirty seltzer where she'll ask for the seltzer with olive juice and have like an olive in it, like a martini kind of thing. And she's like, loves it. So that's just a little anecdote that she's been enjoying.
That's great.
Like that, yeah.
Yeah. Well, it can look beautiful. You can say like, can you give me seltzer and some bitters and throw a mint leaf in there or piece of lemon? Like it looks beautiful. And guys, when the bitters hits specifically the back of your tongue, it triggers that vagus nerve to tell the rest of your body it's time to rest and digest. And so often throughout the day, we're not really sending messages to that nerve, especially so many of us are more in fight or flight, or, we're in that activated part of our nervous system that we're not actually giving our vagus nerve a chance to go like, it's time to relax now. And so you can train your nervous system to do that with a ritual like this, where like you have a drink with bitters in it, you take a deep breath, you just kind of allow yourself to drop in. And some of the other things Dr. Michal was mentioning, like the breathing, right? So doing meditation, breathing, mindfulness will also tone up that vagus nerve. And then the beautiful thing is we have to train our nerves in the sense that like they don't get bigger or stronger like a muscle, but the more you use a nervous system pathway, the easier it is to activate it, the stronger the signal is going to be. And so when you invest in tonifying your vagus nerve, it means that when you're out and about with nothing except your breath or your conscious decision, you actually have more control over the ability to remain calm and be calm when you invest in that training. So both you and I also do biofeedback with folks where we literally will put them on a machine where it measures their heart rate and their breath rate and teach them to control their vagus nerve and to strengthen that. And it's really, really powerful for folks.
Yeah. And it also can be something that you incorporate into what you're already doing. It can be, okay, I'm at a stop sign, I'm at a red light, I'm about to step into this meeting, I'm about to pick up the phone, and I'm just taking a conscious breath and focusing on the exhalation, and that's it. So again, without this kind of the black and white, all or nothing thinking can also be something that is a trigger for alcohol use or for things that are, okay, I'm not drinking any more alcohol, but then you drink some and you're like, okay, so I guess this is totally, I have to throw this to the side. I'm going to just be drinking alcohol again, right? So just to like helping with that, okay, well, maybe it's just a little bit, or maybe, it's reasonable that I'm going to try this out and see how it goes. And then maybe it won't work out that way, or, play with the gray area a bit.
Yeah, I think one of the things you mentioned before was community. We were talking about that when we were talking about sunflower a bit. I want to ask you about that next, because I think there's two elements of community that are important here. One is, community can be incredibly supportive. You can have a dry January challenge with your friends. You can support each other if you do go out to trivia night. And normally you each have 3 beers. Like you can really help each other say, like, you know what, we're all kind of reading this research, and everybody's going to start out with a non-alcoholic beverage, and we're going to hold each other accountable. There's the flip side of community as well, which is that, again, with social anxiety, it can be easier to drink. But also, like, if your habit and your way of connecting with your friends is that you do go out to trivia and everybody drinks 3 beers every time, like, how do you help people, kind of navigate maybe when they have a lot of habits that could lead to even some social pressure to drink? Let's talk about that first. And then I want to talk about all the ways that you can use community to actually support you in adopting some healthier habits.
Yeah, it's interesting because we know this is another example of things we know are good for us. The research is very strong that social isolation is worse than lots and lots of cigarettes each day, right? So when we're thinking about what are the things, where do we put our focus on, So it can be challenging. And so part of it is that strengthening your own self and resolve about what you want to be doing. And so having support outside maybe of people that you already have relationships with who the connection is mostly focused on drinking. So this could be friends or family, could be therapists, could be someone who can just help you so you don't feel alone in this process. There are a lot of support groups as well, not just for addiction, but also just people who are trying to make behavioral changes, or maybe people at a meditation group or whatever it is, or any other activity that doesn't involve drinking. And then it's a matter of just asserting what you need. And I think pretty quickly you get a sense of people that it's the right time for them to be in your life right now, and people who aren't, right? So if you're like, hey, I'm just drinking non-alcoholic beer tonight, just so you know, whatever. And they're like, cool, great, or it could be something like, if you feel the pressure, that maybe that's not the person who's going to see you through this time of life.
Yeah. Or you choose to do like different things with those people, right? Like, I think activities where you are sitting in a bar, or you are sitting and like maybe you normally have poker night and you are just sitting with a beer, like that, it's going to be hard. You might want to consider even switching up the activities you do with those folks. Maybe everybody goes and like takes a walk or goes to the movies, something more active, where you're not going to be tempted because you're just kind of like sitting, chatting, and normally you have your beverage. Yeah, I think it's a good point. Okay. And then when we think about community, you kind of mentioned this, like maybe find some people who have an interest in some things that don't involve alcohol and hang out with them. Are there other ways that people use community to help them reach health goals that you would kind of like advise folks to consider right now, as if they're thinking about reducing their alcohol?
Yeah, and I'll take a step back, as you mentioned, just health goals in general. So I just want to say that behavioral health changes in general are challenging, no matter what it is that you're trying to change. And most people are going to sit with ambivalence, which means that they can, on one hand, see really good reasons to change, and on the other hand, really good reasons not to change. And so one of the examples could be, oh, well, if I stop drinking, then I won't have any friends because I only go drinking with my friends, right? So that could be a reason that I'm ambivalent. I know this has this health impact, but also, who am I going to hang out with, for example? And so just really recognizing that is very common for all of us, no matter what we're doing, for those things that we know this would be a better thing for me, but I'm ambivalent. I can see that it's either way. And so I'll get to your other question in a moment, but this idea of supporting people through, that's okay. That's really okay. And that it's about continuing to come back to it. Are you ready to make these changes? I'll just mention, because I know a lot of practitioners listen to this podcast, of motivational interviewing is probably the most important course I took in med school. That it's because we're going into it knowing you can know all of the laundry list of things that'll be good for your patient, but unless you're able to elicit that from them, that they want to make that change, then we're not going to have the outcomes that we're looking for. So if you ever have a chance to take any course or read anything about motivational interviewing, it's really powerful work.
And for the folks who aren't clinicians who are listening, I mean, a big motivational interviewing is essentially the process of a physician or a therapist or someone, even a coach, helping you get even beyond the stated goal and figure out your why. Well, why do you want to reduce your drinking? Okay, because I want to live longer. Well, why do you want to live longer? Well, I want to spend more time with my kids. Well, why do you want to spend more time with my kids? Like getting to that core value and then kind of working from there can give you a lot more flexibility, a lot more grace, but also help you stay really centered on the goal, which is really important anytime you're making a change. Because if it's just about getting to the gym 3 times a week, I think you and I both have seen those types of goals be abandoned pretty quickly. But if it's like, hey, I want to be anti-fragile and I need to be able to pick my kids up and run I'm the provider of the household, like I'm the protector, I need to be strong. That gets people to the gym 3 times a week in a very different way than like just a goal that they kind of pick out of the air. And then making sure that they have all the supports in place to actually accomplish that is like a big part of that process of motivational interviewing. So for someone at home who's thinking, oh, that sounds intriguing, I wonder what that's about. Like, it's really about what's the core value? Why is this important? And I love that you do. I think it's such a beautiful practice that you have. And it's why it's no surprise to me that you have such success with people in such a variety of ways, because you actually help anchor them back to that all the time. And you respect their autonomy. You really hold what's sacred to them as the most important thing in every single session. So it's never about like, did you stick to your goal of drinking only 3 times last week? It's not about that at all, which is often what people feel afraid of. If they go in and they tell a doctor, I want to drink less, they might, if they think that we're just going to be like the health police, right? And shame them or guilt them or only be interested in the outcome or pass fail type of mentality, they may not even come back. Versus if they know like, oh, Michal's open to helping me be healthy, happy, centered, strong in every single way. And reducing my alcohol intake is, up on that list, but there's 5 other things we're working on. And, she's not going to shame me. She's here to help me. It's a very different experience. And so if you don't have a doctor like that in your life or anybody like that in your life, folks who are listening, you can look for a doc or a therapist or somebody who's trained in motivational interviewing and even ask about that when you call. And that might be a really lovely part of your care team to have.
Yes. I also want to say that it's really centering your goals, patient's goals. And so this relates back, and then we'll talk about community because one of my favorite other topics, as you know, which is that the question that we're exploring today is the link between alcohol and cancer. However, a lot of people coming into the office are not necessarily concerned about cancer. Some people are, but some people are concerned about their reflux or their high blood pressure or their anxiety or depression or a whole lot of other things or blood sugar or diabetes kind of thing. And so there's so many things that I just want to reiterate or iterate that are better when you're not drinking alcohol. Right. So that kind of thing of, whatever you're coming in with is probably going to improve, or insomnia. So it's probably going to improve if you reduce or eliminate your alcohol consumption. And then, Kate, this is what I love about our medicine is like when you watch those commercials for pharmaceutical medications, which nothing against, I think there's time and place and things that can save a lot of lives and improve a lot of lives. However, when you listen to it, there's like, and then all of these side effects, right? And then with this medicine, it's like, oh, you want to improve your heartburn? Oh, you want to stabilize your blood sugar? Oh, and then here are all the positive impacts. Your sleep is going to get better and you're going to prevent cancer and you're going to, so that's another way to look at this, right? So for some people, they're coming in with that goal, but other people, it's maybe the job of the clinician to make that connection also.
Yeah, it's a great point. We're focusing so much on cancer because that's so much of what this new kind of announcement was about. But you're so right, which is that, like, alcohol does a lot to disturb a lot of other things in your body, whether it is the reflux or the disturbed sleep or the rebound anxiety that a lot of folks have. We have a significant portion of our population who, is participating in what's called binge drinking regularly, or at least enough, like at least 60 million adults in the States. Last year, there was a study reported that they had binge drank in the last month. So that's a lot of people, right? And the health impact, you like, whenever anyone does that, you do not feel good the next day. We can go into the science of it, but there's so many reasons that are going to help you feel better beyond just like, oh, I'm probably reducing my cancer risk. Oh, I'm probably going to, live longer in 30 to 50 years. I'll get a few extra days to months to years of my life. It's like, well, how do you want to feel now? Because so much of what we're talking about is going to improve that. So that's a brilliant, brilliant point.
So in terms of community, I think that's what we were talking about. Yeah. Yeah. And I think that, some people feel uncomfortable if there's like there's more and more, I think, sober events. There's even sober bars here where I live in Philadelphia. And sort of also just recognizing activities that are people who just want to drink less or things like that. So, there's definitely out there, if you do a Google search for sober things. It doesn't necessarily mean that you have an addiction. It just means that you want to do activities that don't revolve around alcohol.
Yeah. I'm going to say something, and we call Dr. Michal, I'm so curious if you agree, and you do not have to agree. And that's why I'm prefacing this with, I am going to say something, which is one of the things I noticed with some of my clients is that they were drinking in situations that were like kind of boring. Or where they weren't super happy. And actually finding a group where like you don't need to drink to have fun, where time is flying and you barely notice it, whether you're playing soccer, right, or going on a hike, or you're doing a book club. Like it might be that you need to find other things to do that are not being a bar with folks. And so that's what I love about so many of these like kind of sober community events are like, they're out doing things. Like you're going on a bike ride, you're dancing, you're taking dance lessons. Like so much of what you can do is life enriching. And you may just have to get out of a pattern. If you typically have a pattern where you're going somewhere to drink or you're, kind of staying in to drink, you may end up having to go out and try new things. And that might be really beautiful. A lot of my friends who've been sober ended up picking up hobbies, becoming athletes, right? Like they stopped drinking alcohol. They became an endurance athlete. Now they have this whole community of endurance athlete friends that they never would have had if they kept doing their old patterns that really revolved a lot around drinking. And so there's actually like some new parts of you might discover if you do make some of the changes we're talking about today, and maybe new friends you're going to make.
I agree. And I also, this thought about community going both ways. So this is about creating new community. And the other part is among communities that you're already part of, can you be part of a conversation about shifting maybe an alcohol culture in it? One thing I've seen a lot is faith communities where, maybe after services or at events, there's alcohol present. And maybe it's a conversation of, well, maybe we don't have this, or we have specific times that we're for sure not having wine at the luncheon or whatever it is, to just recognize, again, not just in for addiction, but also just creating that community that is spiritually healthy, but to also bring in this component of health as well.
Yeah, this is awesome. Okay, so we have talked through, I think, a lot. We've talked through the science. We've talked through how do you respond to the science? If you're sitting at home thinking, what does this mean for me, right? You have some approaches and some tools. Dr. Michal, what have we missed that you really wanted to make sure we talked about today?
So I wanted to add one case study general case study of something that can happen because I think it might be relevant to a lot of your listeners, which is through my work in alcohol recovery specifically, we see a lot of increase in alcohol cravings around perimenopause. And this is something that I just wanted to shout out because if you're out there and kind of feeling that way of like, wow, as soon as I hit perimenopause, my cravings went through the roof. I never felt normal. I also want to link this to your conversation about I'm bored, whatever it is that navigating uncomfortable emotions or situations or symptoms can also lead to craving for alcohol of like, okay, here's something I know like sort of works to take the edge off or to make me feel a little bit more normal. But specifically in the case of perimenopause, and then we see where we see fluctuations of reproductive hormones, that alcohol for a lot of people who are going through this process just kind of makes them feel normal for the first time. And I have a lot of theories about this of sort of what's happening in the liver, et cetera. But I think that that's something just to look out for. And generally, when people are going through transition, just right, having that support. Yeah. And you mentioned about trivia night. Let's reduce our amount we're drinking. There's also book clubs that it's very common to have alcohol or wine as part of
True.
the book club. And so maybe kind of reading a book about alcohol and then, having a mocktail event. So yeah, just kind of checking in with that also and supporting each other without judgment too, because where you are in your process and what tools you have available to you to change your coping. If you can, have the time and energy and money to go to yoga classes or get a trainer or whatever it is to or go to therapy even, which can be cost prohibitive for some people versus for some people at this point in their life, alcohol might be what they have to deal with what's going on. So having a lot of grace also in how we're thinking about others and then how we're talking to ourselves too.
Yeah. For women who are in perimenopause, is there something specific that you would say to them about the exact changes that are going on in their brain that might make sense why they might find themselves reaching for alcohol more, or specific interventions that you would consider for that group and advise them to talk to their doctor about?
Yeah, I mean, I think generally, I think it's getting better and better with democratization of information online. But I think generally, a lot of people going through that process are left to high and dry and aren't given advice about what's happening to their own body. And so some of these changes are the fluctuation of estrogen and progesterone during this time can just the hot flash symptoms, the sleep issues, anxiety issues, so much that just make you feel not normal. And so one thing that I think about with alcohol is that it, and this at other stages in the reproductive cycle, alcohol can also make premenstrual symptoms worse as well, because it again blocks the metabolism breakdown in the liver of these other hormones at the time. So it's similar, I think, processes, but in some ways it might even like raise the amount of estrogen for people if they're taking alcohol and help them kind of just have that normal flow. And so I think everything that we have, I know, right? I talked a lot about this, some of the outpatient recovery centers that I've worked at, but part of it is what we'd advise for anyone. So kind of going to a naturopathic or a functional medicine provider or Chinese medicine, herbal medicine, whatever is most resonates with you, to acupuncture can be really helpful, but to help with that fluctuation and to help with, having other tools for coping and to address some of the symptoms that you're trying to treat with alcohol as well.
Well, it makes sense. I mean, so your sex hormones kind of like affect the receptors for neurotransmitters in your brain, right? So we have Dr. Carrie Jones as my famous co-host on this podcast who posts about this all the time and talks about this all the time. It's like your sensitivity to serotonin, dopamine, GABA is changing in your brain as your hormones change. Both throughout a normal cycle, if you're someone who's cycling regularly, and in perimenopause and menopause and transitions. And I would assume it's the same in andropause. So as we age and as our hormone patterns change. But the other thing that you mentioned too is that we have to detox our hormones, and the way we do it is through our liver, one of the ways. And if you're kind of clogging up your liver with a bunch of alcohol or a bunch of other things that have to be detoxed, it's going to affect the way you metabolize your hormones in many ways, which you brought up. That's so interesting about like thinking about, oh, interesting. I wonder if you get some sort of increased circulating estrogen. So really honoring kind of like, I wonder why this is, if alcohol feels good to me right now and it's meets and needs, I wonder why. And I wonder if I could do some root cause analysis to figure out, what are my needs that I'm choosing to use alcohol to meet? And are there other options that I could use? I think it's a beautiful approach. This is the Root Cause Medicine podcast, and it's, we're Rupa Health now, full script. And so I have to ask you, if there's some labs that you tend to reach for, if somebody were to come into you and say, I want to talk about the psychosocial, spiritual part of, why I may or may not be using alcohol. I want to do a check under the hood. I want to see like, how's my body doing? But also like, are there some sort of root cause contributors that might be increasing my cravings for alcohol? What are some biomarkers that you would think about checking?
Yeah. I want to answer one other question first, and then I'll get to it for sure, which is talking about the hormone levels and the changes during different parts of one's cycle and life and hormones. I also really want to emphasize the importance of maintaining blood sugar, which I'll mention a lab also, because hypoglycemia is a major trigger for alcohol. When we're feeling hangry, when we get that state, right? So making sure that you're getting enough fuel, protein throughout the day, and then our needs go up in premenstrual time and in perimenopause. So again, these are other reasons, and that changes serotonin levels. So feeding yourself, nourishing yourself is also a way to make sure you don't want to go to the bar hangry. Is what I'm saying.
Yeah, and you can check things like, I'm guessing you're going to say like insulin, A1C, blood sugar.
Yes. So in this case, we're starting here looking at blood sugar markers. And so you might have your hemoglobin A1C checked, which is a 3-month average of blood sugar, but it doesn't necessarily show you the fluctuations, because what can happen is that it can dip down and then it spikes, your cortisol. So then it goes up and then your insulin gets spiked and goes down. And then you're just like, why am I feeling so all over the place? And that's a big reason why a lot of people, so I see that a lot in my practice, just in mental health and anxiety. But looking at for fasting glucose and insulin can help us look at, is there signs of insulin resistance creeping in? Even before you would see it as a frank prediabetes or diabetes diagnosis, are there ways to support balancing blood sugar there? So that's something I would look at. This can be even a conventional lab. We talked right at the beginning about what are the cancers that are increased risk for this condition, and they're cancers mostly of the digestive tract. And so I do like to look at the digestive tract, looking at, if we're looking at a functional medicine test, I'd want to look at kind of comprehensive stool analysis to see what ways to support. In some ways, if it's a chronic use, if it's something that's happening, the frequent use of alcohol, then we can make certain assumptions as well. But it can be helpful to have the information and that data that, okay, well, I was feeling like my level of alcohol use was okay, but now that I see it in this data, I'm like, I'm not sure. And so to that point, like liver enzymes, looking at the a liver panel, and then additionally GGT can also look at additionally information specifically about how alcohol is affecting your liver enzymes. And then looking at just generally, again, I think the digestive tract is it's going to be a high yield here because it's specifically where the alcohol is affecting. And thinking also about the gut-brain connection, that what you're experiencing in your digestive tract is going to reflect how your mood is, how your brain inflammation, and then sort of vice versa. So that'll be a lot of information. So then it just depends on the individual. It might be helpful to do a nutrient assessment, a more in-depth nutrient assessment. Again, we can do the shot in the dark where we're like, all right, we'll just take this, very helpful and very, again, if that's within the means you have to work with, which you and I both love the democratization of this information of like, yeah, probably if I try multivitamin and a good B vitamin with methylfolate and B12, that let's try that. It's not going to hurt, right? So, but then also making sure that, right, we're looking at, are there other nutrients that could be affected? How are my precursors to my neurotransmitters, the amino acids? So a lot of places where we can get that data, which, like we started this conversation, what's the utility of knowing this information is it has the possibility of changing behavior or changing the way that we're living, or moving through a plan. So those are reasons why getting this information, right? We have that big information that alcohol use could be affecting your health, and here's our personalized information of how it actually could be affecting us, and be able to then track that and trace that as we're improving, which can be motivating as well.
I love that. Personalizing a plan, personalizing your understanding of its impact. Beautiful. You mentioned nutrients. So like, I'm thinking like you mentioned panel. So like there's the NutriVal panel. There are these like big, huge, SpectraCell, US Biotech, like a bunch of companies will give you a panel of like 40 different nutrients you could test. Your doctor can also run a lot of these in your blood in your regular annual screening. I hope what you guys are hearing, non-doctors, well, you know what doctors do, is that this era of like, my liver enzymes were fine, so I'm good, is a little bit outdated. You want a doctor that's going to look at GGT, that's going to look at insulin, that's going to look at nutrients, that's going to look at hormones. I love that you mentioned adrenal stress too. So maybe even looking at cortisol, depending, or adrenal reserve, right? Like how are your adrenals working? Because when your blood sugar drops low, your adrenals have to kick out adrenaline to tell your liver to break down sugar and push down to your bloodstream. So you're taxing your adrenal glands. In perimenopause, so much of our sex hormone production now is kind of like shunted with, your adrenals are kind of taking over a lot of that. So super helpful. If you're someone who wants to investigate that, there are tools for you to do it. So getting that sort of like personalized snapshot can be super helpful and can tell you where to focus. Because even if you are having blood sugar issues, it might be that part of it is in your adrenals, or maybe you have no akkermansia in your gut. You won't know until you do a comprehensive digestive stool analysis. Like there's so many inroads to helping you feel better if we can find that root cause. So that's awesome. Thank you, Dr. Michal. You stayed for so long. I was like, it'll be 20 minutes. We'll just talk for 20 minutes about the news. And thankfully you had the time to stay with us. I would love people to know where to find more from you. Where can they find you? Where can they learn about what you do?
Yes, I am so excited to have just moved back to my hometown, Philadelphia. It started Philly Naturopathic here. So I'm seeing folks in person here in my office, and also in telehealth and phillynaturopathic.com, and then various social medias and such.
I love it. And everyone should go visit that site. And I'm going to brag about you for a second, because I think you did a very succinct job of explaining what you do. I think I frequently refer folks to you. I'm based in Philadelphia as well. I'm not seeing patients. Anytime anybody asks me for a recommendation for a clinician, almost for anything, but definitely focused on anything mental health, I send them straight to you. So it's rare, listeners at home, for a naturopathic doctor to have experience in sort of like an intensive setting for mental health, whether it's addiction or recovery or psychiatry. And Dr. Michal not only has that, but she also has experience facilitating groups. She's really brilliant with using nutrients as really intensive support for mental health. So like understanding how to use amino acids in the support of a particular mental health picture, whether it's anxiety, depression, you name it, understanding how to do the root cause testing for it. If you are looking for somebody in the area for that, please. I mean, you have like a free discovery call, right? Yeah. Go schedule that with Dr. Michal. And I'm excited. You also have a ton of articles you've written with us at Rupa Health, where you have just kind of explained this information. You have a course with us. So we are trying to shine a spotlight on Dr. Michal because she's excellent. And so I really appreciate you coming here today and giving us so much time. We will certainly have you back because we're going to have more questions about this, I think. But thank you, Dr. Michal, for being here today.
Can I say one last thing before? So I was thinking about a question that you didn't get to, but was like, what's the one health recommendation if you could just do one?
Ooh.
And I thought a lot about this, and the one is start speaking kinder to yourself.
Oh, I love that. Yeah. And why?
There's even research that negative self-talk increases inflammation, that it affects our ability to really access the tools for change, for that self-compassion. If we're constantly, our inner world, our environment is constantly feeling under attack, it's going to affect our body and our health. And so I wanted to just leave us with that because I think it gets overlooked, but taking steps through therapy, through journaling, through just kind of the every single day and minute, the way that we're talking to ourselves does matter, and kind of being a little bit kinder.
I'm so glad you brought that up because I think a lot of times the way people approach health change or behavior change is to shame themselves into it. Right. And like that doesn't work. We know it doesn't work. You can't hate yourself into the version of you want to become. It just, I mean, everybody has tried it. We've seen it thousands of times. You have to be your own ally. You have to have your own back. You have to be proud of what you're trying to do. And so I think that's beautiful advice and so important for this topic, which can be really emotionally charged for folks, to just say like, no, let's have some self-compassion and kindness around this is so critical. Thank you for bringing that up.
Yeah.
Okay, amazing. And again, guys, this is why we bring Dr. Michal on. We will see you again soon. Thanks so much for being here.